Okay, close to the microphone. All right. Hi, my name is Michelle Lohr. I am the REDCap application manager at University of Illinois, Urbana-Champaign. So I commuted to be here with you today. Thank you so much for having me. Today, I'm going to be talking about MyCap. Dr. Harris talked about MyCap a little bit earlier today during his keynote about some of the improvements they've made to it. I'm not going to talk about all of that amazing functionality. I'm going to give a very brief overview, just so if it sparks any ideas for anybody, or you think, oh, that would be a really great match for this research that I've been planning. So what is MyCap? This is a participant-facing mobile app. So it is an app that participants download on their phones themselves for collecting data via surveys, and also something that are called active tasks. Active tasks use sensor information on the phone or a tablet during data collection. So they have all kinds of things like tapping tasks or trail making, those kinds of things for a different kind of data collection that cannot happen in just like a web-based survey page like we commonly use REDCap. This is really best suited for longitudinal studies that have frequent surveys or tasks. If you're doing a longitudinal study where it's just an annual check-in or twice a year or once at time point 1 and another time at time point 5, that's not a great use case for it because you're asking somebody to have something on their phone for however long. So really thinking about weekly, daily studies, monthly studies, that kind of thing where there's a lot of frequent contact with participants. This is a really difficult flowchart to read, so I will not read it to you. These slides will be available. This is a flowchart made by Vanderbilt University Medical Center of when it's a good idea to use which different features. So thinking about what is your study, how are you going to be interacting with participants, and based on that, what REDCap platform should you use to capture that data? So obviously, we're talking about MyCap right now. This is not to be confused with the mobile app, which is a researcher-facing mobile application that is best used for when you are in like rural locations or locations that don't have good access to Wi-Fi, so you can collect data offline and then sync it to the servers once you're back on the internet. Also thinking about that frequency that I was talking about, if you're collecting data frequently from people, as well as just the best way to do it. So I'll let you look at that in a minute or later. All right. So how does MyCap work? You set up your REDCap project and have MyCap enabled. Because I am not an administrator at your institution, I don't know what that means for you. I don't know if you have to ask permission or if you can just enable it yourself. I'll let you contact your administration team about that. So you enable MyCap, and then you have to set up all the MyCap surveys and tasks that you need. We'll look at that in a second. Then you need to create a participant record in your project, either via survey or data entry. So you essentially have to pre-populate your project with the records before they can onboard into the MyCap app. Once those records are created, the participant downloads MyCap onto their device. You onboard them probably through an interactive session, either over Zoom or in person. They can sync to the project with a survey link or a QR code, whatever works best, or both. You can send them both. And then the participant will complete surveys and tasks on their device. They will get a push notification in the morning that they have something due. And I know it's on the roadmap somewhere to have more time custom push notifications, like say if you want them to do something in the evening or in the morning or at a specific time. But right now, I think it is just push notifications in the morning. When I say set up MyCap tasks, that might be hard to visualize. So we have a screenshot here. So MyCap is enabled in the project, and then in MyCap or on Online Designer, you'll enable all the appropriate instruments as MyCap tasks. So usually you just have the column to enable things as a survey, but now because there's MyCap in this project, you see the additional column to enable as a MyCap task that has the little My with a red hat on it, and that's the MyCap logo. So when you enable those, it'll have a bunch of, similar to survey settings, it'll have a bunch of things you can set up of how many times you want somebody to take it, how frequently, at what time points, all that kind of stuff. Once you are done setting up those MyCap tasks, you always need to publish the new MyCap version, and that will push the MyCap version to the app. So you have to save it a lot, especially as you're making changes. It'll give you a little warning in the corner if the MyCap version is out of date. Something that is really important to think about is what is the security of this. And so when a participant is being onboarded into the app, they will create a 6-digit code that they will need to enter every time they open their profile. So you can have multiple profiles on one device. Maybe you have a parent and child or 2 partners that are enrolled in the same study. And so every profile will have their own unique 6-digit code that they set up. Data is only stored locally on the device if there is not a current internet connection. And if it is stored on the device, it is in an encrypted database. And once data is successfully synced to the REDCap server, then the data will be wiped from the device. Some use cases. I think when Andy Aronson asked me to talk about this, he was hoping we had somebody at Illinois who was using MyCap for an amazing reason, and I could share that. However, we have seen very slow adoption of MyCap at Illinois. Sometimes people will flirt with it, and then they end up not using it for whatever reason. But I pulled these use cases from the Project MyCap website. So one is from the University of Washington in Seattle and the Sammamish True Medicines organization. They conducted a pilot study to look at the efficacy of mobile apps and measuring or encouraging medication adherence. And so MyCap has photography functionality and video functionality as well. And so they had to daily take a picture of their pill and answer some questions with it. And then another one that I wanted to record or make note of because it includes those active tasks I mentioned, it was from Weill Cornell in New York to look at Parkinson's patients and healthy controls, and by utilizing one of those active tasks, specifically one where you like tap really quickly on your screen. So participants completed the active task twice, about an hour apart, 3 days a week for 5 weeks. So that very frequent contact with the participants. If you would like to learn more about MyCap, projectmycap.org is Vanderbilt University Medical Center's homepage for it. And one of the things I really, really like about it is that they have a lot of amazing demo projects that you can go enroll in as a participant. So you can experience that participant side of things, figure out if it's a user interface functionality that you think would be really good for your participants or a study you have in mind without you needing to learn MyCap first. And so they have demo projects for basic functionality for those active tasks and also to look at some of the longitudinal features with the scheduling. I think that's my last slide. Let's find out. It is. So I'll pause there for questions because I think we're taking questions throughout.
I really appreciate you going over that. Does it allow, is it all or nothing? So if we have like, I do symptom management, so we have weekly symptom assessments in our trials. Do we have to do all MyCap, or can some patients use MyCap? Some of the patients do it on REDCap and it will sync with their REDCap account.
Yeah, you can do both. I think just thinking about if there's like the active task functionality clearly would only work in MyCap and those kinds of things. So if it's really more about giving participants those daily or weekly surveys in a way that is most accessible to them, you could definitely combine and have some people on MyCap, some people on the like base REDCap through a web survey. And then I'm not entirely. Dan nodded. I don't know if you have. Okay. If I don't know what that would like look at seem entirely in terms of like making sure the people who are not on MyCap are getting their survey invitations correctly and all that stuff. So I think it would take a little bit of testing and making sure everything's lined up. But as long as you're not using active tasks, then it should be pretty okay to have some on MyCap, some on base REDCap.
Just piggybacking off that question, if you did have a mixed model where you were maybe using survey invites and then some are on MyCap, would there be any possibility that the MyCap would override survey answers that had already been completed if that is how they're being distributed?
So each record would be individual to one another. So I don't think you should give participants an option to complete something in both fashions. I think they would either need to be like this, they complete this instrument on MyCap, they complete this instrument as a survey. The way REDCap generally works is if a survey link has been accessed or completed, as long as you haven't given people the permission to return and modify completed responses, they can't reopen it. And so there should not, unless you have that enabled, and I don't even know if you can enable that on MyCap, you should not be at risk of anything being overwritten. Thank you. Oh, Bev has a question.
So in these activity capturing data, what actually gets stored in the database? Is it a video or is it frequency of tap?
Yeah, so that really depends from task to task, and it does take a little bit of deciphering to figure out what exactly the data is telling you. Because we don't have many active users at this point, I can't answer your question super well, but it will, I think for some of them, it's like a reaction time. For some of them, it is a, an accuracy, like there's a memory test. So like how many times did you get it right and like up to what point? And then there's also some metadata captured that comes in like a very strange JSON format that takes a little bit of deciphering. So the output depends on the active task. And then I think there's a little more work to figure out how that fits in with the larger data set and a little bit of cleaning. Great question.
Just for everybody, one good resource for that is both the sets of active tasks are based on the NIH mobile toolbox, and I think the other one is like the Apple research kit. Both of those have like very extensive documentation about the store data and what it actually means. So that's, for me at least, that's been a really good resource.
All right. My name is Chris Hobbick. I'm the Director of IT and Strategic Initiatives for the Medical Molecular Genetics Department within the IU School of Medicine. Our group primarily focuses on biorepositories, specimen management. We do other data collections for other kind of types of data, but the vast majority support kind of neurological diseases, Alzheimer's, Parkinson's, Huntington's, alcoholism, fetal alcohol syndrome. We're all NIH or privately funded organizations through NIA, NINDS, Michael J. Fox Foundation, Parkinson's Foundation, and then CTSI as well. So our group is made up of our three largest biorepositories are NICRAD, BioSend, and the Michael J. Fox biorepositories. You can see there kind of the diseases that they're focusing on. I won't talk too much on that just to keep this moving. And again, just kind of like our kind of org chart just to show our sizes. So this may be a little inaccurate now, but our laboratory, we've got 64 at that time, 64 people, project management, 44. And then on my team, I've got 14 software developers or data analysts that manage all of our items. So what I'll be talking about is the kind of the REDCap API. I'm not going to go into how to use it, but I can discuss, I think Andy might mainly want me to provide some use cases of how we use it. So the API, for those that don't know, it just stands for an application programming interface. It's just a way to interact with the data. You can either pull data from the REDCap database, or you can insert data depending on what permissions and the API key that you have. For that, we use it for everything. So we have our laboratory system, Open Specimen. So we've got data there. We have data that's being collected by studies in their own EDCs, and we have sites enter data into REDCap, and we're doing a lot of merging of data constantly. And so in this scenario, so for the IU REDCap to IU REDCap, so there's scenarios where we're collecting data in one REDCap project, and we want to make some sort of master REDCap project. And so a lot of our features you might be able to see in other modules that exist, but we've been going for so long that we've kind of made some of our own. At some point, it might be worth switching to some of the other modules. But for example, we've had projects where we're consenting participants. We might have to have them in multiple projects, but we want to have one single kind of project that we can manage and see all the data at once. And so in that case, we're using the API basically to pull the data from external and put it back into a different project. And so to do this, you do need to have some level of programming knowledge. This isn't, there's not just a nice, easy user interface. So our team typically uses Python or R. So if you do have, a team of software developers, or if you have somebody that wants to learn programming, it's not that complicated, but it is, more into it than just kind of the point and click user interface. So for the, I had to write examples down because I knew I was going to forget them. So one of the another use case, we actually for a lot of our studies, we have this collection sites. So we have national studies that are sending us samples, and so typically in the past, we've gotten paper forms in from the sites, and they'll tell us things like when samples were collected, how they were processed, how they were, what time they were frozen, all of that kind of information. And they would write it on paper and send us in with the samples. And so now we've been able to have sites actually log in or go to a survey really into a REDCap project. And we collect that same information. So now it's in the structure. We don't have to worry about, data. We've got data entry errors, but handwriting and all that kind of stuff, issues with that. And then we take that data and we actually can now export it from REDCap and import it into our laboratory system into a form there. And so then we can leverage the query builder in that system to leverage the same or utilize the same data that sites collected. So that's an example of where we just set up a script that runs nightly, pulls data via the API from REDCap, and then inputs it into or inserts it into our laboratory database. We also have the Indiana Biobank, which is one of the biorepositories we support. They have many consenting projects. But for them, it's difficult when they get a question or we get samples in, it's not always evident what project or what REDCap project that person signed the consent. And so what we've done is we actually export the information into a single application, a custom application, that then the study team can search, find that subject, see which project they consented, verify that the consent is complete, there's a signature, all of that kind of stuff. And otherwise, it would be hard to search across all of the projects to find where the source record is. We also have members from our pathology team. So we have a brain donation project through the Michael J. Fox Foundation. And with that, we actually, the study itself has another EDC, and participants can just mark that they're interested in learning more about brain donations through that consent. We then scan that data each night, find people who have said that they're interested in that. We're actually able then to pull that subject's information from their EDC and insert it into a REDCap project for our pathology team, where they manage the pathology consent and brain donation information. And so that comes in automatically now for them. We used to have sites have to do referrals manually. And we missed quite a few where sites would, forget to come and put in a referral. And so now using the API, we're able to get all of those referrals immediately while it's fresh in the participant and their family's mind, and contact them and talk to them through the process. So there's just a lot of ways to be able to pull that, push it. We also have, finally, my last one, We have a project with the Parkinson's Foundation. They actually use REDCap themselves, and they have subjects that enroll into their study from there. And some of those subjects are able to do genetic counseling with our team. And so for those that are eligible, their information we've set up that travels from their REDCap project to our REDCap instance into our REDCap project. All of that is done by scripts, leveraging the API. So it really is a good tool to be able to manage data flow, centralize data where you need to centralize it, integrate data together when you need to do that. It's been a great benefit for us. At that, any questions? Perfect.
All righty. Thanks to the IU REDCap team for inviting me to join this panel. Really appreciate it. My name is Jeff Warvel. I'm a data engineering manager at the Regenstrief Institute for Healthcare. Many of you may or may not know what that is, but that's a local healthcare research group founded in 1969 by a guy named Sam Regenstrief and his wife Murdy. Their goal at the time was to improve healthcare and its delivery. The Institute is a pretty large organization. We have basically 5 different centers or programs performing a variety of different research at any particular time. So that brings us to our use case. One of the centers at the Institute was performing a lot of aging research care, and they had 8 different competing studies in REDCap and human subject studies that were going on. And a lot of these were having problems with one study trying to recruit an individual and another study trying to recruit them at the same time, or they were already enrolled in another study. So we had this overlapping populations of recruitment sites. And there was really lack of tools for the research staff to cross-check this and make sure that a participant wasn't getting involved in 2 different studies. So a lot of this was manual work that they had to do, check in with the other teams, check in across the IRBs to manually compare, either enrolled, ineligible, or deceased participants. So initially, back about 4 years ago, they tried to leverage some of the notification and alert features within the REDCap system to help identify and then also communicate participants that were being approached or enrolled on different studies and communicate those to the other teams. So various teams would just receive those alerts and manually have to update both the REDCap projects and their manual lists of which persons were in which studies. As some of these studies for aging research were quite large, a potential population of 6,000 or 7,000 people. So this got to be kind of out of hand to try and manually continue to manage these lists and communicate across the teams. So with the alerts, there was some automation, but still a lot of manual processes going on to try to keep everybody in line. So next, the team came up with a solution that got the unique little name that I had no help in defining this, but kind of came out pretty cool. PERCS, which is the Participant Enrollment and Recruitment Coordination System. And so this was a web-based database application that was developed in-house and used the ETL module in REDCap that I believe is actually developed here at IU. Yep. So some of you aren't familiar with that. The ETL module basically allows you to automatically pull data out of any of your REDCap projects and throw them into external databases. So this tool connected to these databases that we'd pull every night from these 8 different REDCap projects. And this allowed the coordinators to check the subjects for any recruitment activity or changes in recruitment for all the subjects across all these 8 different studies. So one of the ways we handled this is we performed basically patient matching person matching on the participants, and we also use date of birth sometimes to try and match these across different studies. So again, this relies on the REDCap ETL module, pulling the nightly data from 8 different projects. So just a real quick flow diagram, projects on the left there, the REDCap ETL module, pulling them out, and we throw them into an intermediate database server. The reason we did that is because the way the ETL module works is every schedule, whatever that is, nightly, weekly, whatever, basically recreates all those external tables that it populates from the REDCap projects. So you kind of have to have this working intermediate database server that then fed our perks ETL databases and transform and matching processes that then presented that information to the application. Just a real quick screenshot here of some of the matching presentation that would go on in the application itself. Again, these are all fake people, but essentially would show 2 persons on 1 or 2 or 3 or 4, however many more studies that they were potentially assigned to. You'll see there in the 4th column that we included the status, whether they were currently being approached or they're enrolled or recruited or refused. So just a couple quick tips on the REDCap ETL module. Some good online instructions. You can find that in the module under the application section in REDCap. When you start using the module, it's good to let it kind of decide how to transform the data out of your projects. So there's a method to auto-generate all the content within all the different forms within your project, and it can decide what kind of data types they are and how to export them. There's also another nice feature that the REDCap ETL module has to produce labels. And so this is for questions where you have multiple choice questions that can have 5 or 6 different answers. It can then put the actual labels on those answers to know what they are. So if you had gathering patient's race or ethnicity, it could provide those as labels and give the actual content rather than an integer represent the answer to the question. Again, the database setup, chart tables are cleared every night, so that's something you need to be aware of. Additionally, whatever accounts you will use to pull that data out of REDCap and then store in your own local database will need advanced privileges so that you can re-invoke grants and permissions on those tables that are recreated every night. It also has a more advanced feature that we started using maybe a year or 2 ago that allows a workflow so that scheduling of ETL extractions don't collide with each other. And so you can have a workflow of one-to-many different extractions that happen one after another sequentially. So that was a nice way to avoid any collisions of populating the external database. One of the big challenges that we had was around the REDCap project design. Since we kind of came in and built this application after these 8 REDCap study projects had been created independently, we had to attempt to normalize the data into a single form that was understandable by our application. And so we tried to encourage people to adhere to a set of guidelines we created when creating REDCap projects with specific fields and how you store them, whether it's the person's name or their date of birth or their record identifier or other common elements that were needed through the study teams themselves. So any questions on the REDCap ETL module? Sure.
Oh, okay. And while I'm walking back to give the microphone, the man who developed REDCap ETL is sitting right here monitoring Zoom. So Jim Mullen, yes.
Can the REDCap workflow stop collision from the ETL running across different projects?
I wouldn't be able to answer that, but Jim might.
And then my other question is there, I know for the scheduler, you can pick 1 time per day. Is there a way to pick multiple times per day?
I don't think there is. I've not seen that.
I'm not sure I understood the question exactly. I mean, the workflows will prevent collisions of, the individual tasks in the workflow. So they'll run sequentially, but it doesn't prevent collisions with other processes going on. Says if you do anything. And as far as running things multiple times per day, so Andy Aronson actually can be blamed for only one time per day because he was concerned about the system being overloaded. But there is a workaround to that because you can just create multiple REDCap ETL configurations. So you could have like a morning configuration, afternoon. So each one can only run at one time per day, but you can create multiple configurations that basically do the same thing and you can copy them. The downside is if you make changes, you're going to have to update them in both places.
And our experience with the workflow was pretty good, even though we had 8 different projects and the end resulting database was some 40, 50,000 rows. We just figured out how long they typically take and then scheduled it around that. I mean, you have a 24-hour window if you're doing it daily to make sure you can fit in a slot. And so we never really had problems getting that to not collide.
Any more questions?
Thanks, everybody.
Good afternoon. My name is Bev Musick. I am a principal scientific data researcher in the Department of Biostatistics and Health Data Science. I've been managing human subjects research, data for human subjects research for almost 37 years now here at the university. And I'm going to talk a little bit about the REDCap API sync module. So much of my work over the past 20 years has been with one research project that takes place around the world. It's the International Epidemiology Databases to Evaluate AIDS. The Data Coordinating Center for the East Africa region is housed here at IU in my department. And there are 6 other regions worldwide that collaborate on HIV research and associated diseases. We currently have a collaboration amongst 12 low and middle income clinics, HIV clinics, and each site has a standardized REDCap project that's used to collect data prospectively on these persons living with HIV. The aim of this study is to look at the epidemiology of non-communicable diseases and aging. So we're looking at things such as diabetes and hypertension and liver disease. So in order to track patient enrollment, study milestones, quality control, and so forth, we wanted to create a summary report that captured data or captured the results from all of the 12 sites. And this is just a snapshot of a header for that report. This report was developed by a team at Vanderbilt using RStudio and the REDCap API tokens. The REDCap project for East Africa is housed on the IU server, on the IU REDCap, which many of you know, or at least at this time, had fairly strict policies regarding API tokens. And actually my department has what we call an API token vault, where we can store PIDs and API tokens for use with SAS, Python, and R. So in order to get these data to the Vanderbilt University so that they could extract data, we created a mirrored project on the VUMC REDCap installation and are using the API sync module to transfer data from the IU REDCap project to Vanderbilt on a daily basis. There are approximately 24 forms in this REDCap database, and I think we have about 400 participants from the East Africa region. So this then allowed the Vanderbilt team to create their own API tokens to extract the data from the East Africa or a mirrored version of the East Africa REDCap database. Any questions?
I had one quick one here, Bev. So just to make sure I understand, the API sync module is syncing API tokens, or is it syncing data across?
It's actually syncing the data. So the data get transferred on a daily basis from the IU REDCap database automatically into the Vanderbilt REDCap project. And occasionally, if you make changes then to the structure of the IU REDCap database, you have to then upload a new data dictionary or make sure that the structure of the Vanderbilt REDCap has to conform with that of the IU project.
I have a question. So do the fields have to match exactly names and the numbers?
Yes.
Or can one project have additional fields that the other might not?
That's actually a good question. I think they have to be identical because I recently added new variables to the IU and we ran into sync issues because those had not yet been added to the Vanderbilt. And on a daily basis, the Vanderbilt database, as you would expect, gets overwritten. Any data there gets overwritten with whatever is sitting in the IU REDCap.
One is a parent and the other is a child receiving.
Right.
Any questions?
So there's a question in the chat, how does the IPA sync module handle data deletion? So because it's sending all the data every day, if a record has been deleted from the IU project, that record will no longer be submitted, and so it won't exist in the Vanderbilt REDCap project either.
All right. Oh, I see a hand up in the back. We should have got you roller skates.
Really? I brought it. Walking off all that pasta.
There's also another question online. Is there a way to send data incrementally? That would be a question probably for Andy Aronson or the REDCap developers. I do not know.
My question, I'm just not super familiar with the API. So what is the benefit of using something that syncs data at the end of the day versus having a centralized build and then providing access to that institution's REDCap and having them just enter data directly, like using data groups?
Why not have external people log into a central REDCap versus distributed? Is that the gist of the question?
I'm sorry,
Right.
we couldn't hear you.
Is it the gist of the question, like why not just have one central REDCap database that everybody logs into to enter in their data versus
Right,
having
right.
satellite ones that feed into a central one?
Right.
Right. So we, so for IRB regulations, we had to house the participants from the East Africa region on the IU REDCap platform. We could not use the Vanderbilt platform. Some of the other regions were able to use the Vanderbilt platform. At the time that this was created, we have additional prospective projects now where we give access to Vanderbilt users. We give them the ability to create an API token for themselves so they can extract directly from the IU project. At the time this was set up, I think there were restrictions that only internal IU personnel or persons that had been granted IU REDCap accounts could access this project. So there may be an easier way to do this by allowing external users to that aren't involved, that aren't on the IRB, to access directly the databases directly.
Yeah, go ahead. So just to add to that, we have a similar module that does something quite similar, but one of the big reasons why we don't just have external users log in, PHI. There are a lot of organizations that are just going to refuse to give you any kind of PHI, whether it be a name or an email address, most specifically. So their instance will collect survey data. They will have the PHI on their REDCap instance. The data gets sent to us as de-identified and stored in our REDCap database, along with many others. And I don't know if that's a similar concern that you were.
Yeah, we have some PHI.
I was just going to say another possible use case that we've seen is like sites or site PIs may want to collect additional data that doesn't get synced with a central group. So we always work with PIs at different sites that either want to collect different samples in addition or want to collect other data in addition. And in this way, you could collect all the data that you wanted and then just sync the data that you are that you need to sync centrally. It may have nothing to do with how they were working, but that's just another use case.
Just, I think they want you to use the microphone so that the folks online can hear.
So do any of you encounter a pattern of resistance from the IRB for any of this functionality? Like maybe like some of the API examples you gave, REDCap to external, vice versa?
I just speak real quick and I'll let you speak. So I think like a while ago, yes, there was a lot of issues and we, my group works closely with the data stewards and the privacy office and the security office. And we're extremely transparent with all of them. What we try to do, we're always doing some weird thing to that the other groups haven't done yet. And so we also work with the Secure My Research group just to make sure that, that they've kind of signed off on it. And then over time, certainly, I think the IRB has seen, the standards that REDCap, the security standards that they have set. And as they become more comfortable with REDCap, I think they allow a lot more of these things. But certainly where you're putting the data matters when you're taking it out of REDCap. And so, so we always, try to put it in a system that's already been approved or a system that we have to get approved before we do it.
Yeah, and I might just add that whenever we can, we try and create REDCap databases that are limited or de-identified databases so that we don't even have to worry about the PHI. Obviously, when you're enrolling participants in a study, you need some way to link a study identifier with an actual individual. And what we typically do is we have our East African colleagues set up a REDCap database on their own REDCap installation and that provides that linkage between a study ID and an individual.
I just kind of want to know what the difference is when using an API token and then an API script, like Chris was talking about for external databases and REDCaps and things like that.
So the token is just a way to authenticate and authorize yourself. So it's just like a username and password. And so the user that's going to be using the token logs into REDCap and requests an API token. Once the REDCap team approves it, when they log in, they'll see it's just a really long string of letters and numbers. And then in your script, when you're running different API commands, like a get or a put command, you have to first authenticate and and authorize yourself that you have permission to access this project. And if you're pulling data, access to export data. So the token is just a key, a username and password basically, and all rolled up in a single value. And then the script is using it to do whatever the script is going to do. Yeah.
So I mean, you all probably know you can go into your REDCap database and download your data, but that's going to be a static data set that you get. The API tokens allow you to access at any point in time the live data, so you don't have to download and then work on a static data set.
And like just to hammer in behind the scenes. So like the scripts don't do anything with the web interface. It's the script is hitting the API itself. It's like a different, instead of HTTP or HTTPS, it's a different interface. And so the scripts all do this behind the scenes, never touching the website. But yeah, essentially it's either reading data, pulling it, or it's inserting data, all behind the scenes.
And just to add, the API functionality really does allow you to use a lot of different programs with REDCap. And it can be, as simple as like I have scripts that will pull data into an Excel file automatically, so I don't have to go and export the data. Or you can do things as amazing as these folks are saying, where you can push data and pull data all over the place. All right, I think we're getting on time, so I'll start with that. Yeah. So I wanted to give a little bit of information on an external module that was developed by Luke Stevens, our man down under in Australia, who's one of our REDCap admins that we work with. This external module, we installed it in our instance about a year ago. It's been extremely useful. I do encourage folks, if you have it available here, take a good look at it. It's called Copy Data on Save. And in this story, the villain of the story is going to be the PI. So if any of you are PIs here, I apologize. The thing that we get passed along to us as admins and that people come to us is, I want all my data in one project. This is a common request by PIs and often leads to ruin, usually further on down the road than they would like to imagine. So I wanted to really present this as the reason why you might want to consider using Copy Data on Save. So a lot of times if you have a REDCap project and it's supposed to be collecting everything and doing everything, you get kind of like a Frankenstein's monster, right? You have to turn on things like the scheduler, you have to turn on things like longitudinal settings, ASIs, lots and lots and lots of things. And the project can be very unwieldy in the end, very hard to manage, especially when you get further down in the data collection and someone says, hey, we wanted to do this other thing. And then you realize you might have to go and kind of undo a bunch of work that you've already done to make it work in the first place. And so what Copy Data on Save allows you to do is to make very well crafted projects that do only one thing really well, and then take the data that they produce and move them over into other places in REDCap. Now, I'll go over some, the common examples, but in this illustration, you can see the most common one I see is having a screening project, an e-consent project, and a data collection project. This really does allow you to have a project that only does screening, right? Where you might have like 10,000 records and you only really care about like 20 of them. So you don't have 10,000 records in your data collection project. You only have the records that might have then gone to an e-consent process. And then once they've consented, ended up in a data collection process. Now there are other, cool tips and tricks to use with Copy Data on Save, but this really is the most common one, which means you can make your screening project work really, really well. You can make your e-consent, and at our organization, we have a kind of a well-crafted by an amazing REDCap admin, the e-consent template, which we have our users use, and that gets approved by our compliance office. And then you can have a data collection project based off that as well. So just the very basics of the Copy Data on Save is, if you have two projects, right, you need to install the external module on the parent project or the donor project. This is where you install the module, you enter in the configurations. One of those will be which project to send it to. So you want to make sure that you also have access to the child project so you can select to enter in data into that child project. There are, a multitude of settings, and we'll get into a couple of them. But one thing just to remember while you're setting this up is that the access is going to be appropriate, right? You need to make sure you have access to both the projects, not just for setting it up, but for logging purposes as well, because data entry will be entered in under the person who had access to the copy data on save external module. And then we'll go into the details in just a second. The basics are is you set up, what conditions will trigger the copy data on save. So that must be an action where somebody saves data. I call this out specifically because the copy data on save will not work on data importation. It will only work on actually saving data into a project. So someone physically has to save it, whether that's through a survey or entering data on a form. Once you have those two projects aligned and say, I have these triggering conditions, which can be as simple as this form has been saved, or it can be as complex as whatever REDCap syntax you want to put in there to say, as long as this form has been saved and the person has identified as a left-handed person, then you do the copy data and save. So you have a lot of kind of options when triggering the different scenarios. And then you have an additional set of options as well that go along with that for mapping the fields. So that's like, what is the naming field? So usually that's record ID. Most common examples say record ID in parent project is the same as record ID in child project, but you don't have to have it like that. You also can configure things like data access group mapping. You can configure things like longitudinal event mapping. You can do things like specific fields are collecting values, but they should be put into a different field that doesn't have the same value. So you could align different fields to enter in data. And I know that might be nebulous. I'll give an example in just a second. But one thing out of these complex, not so basic settings, I just want to remind people is that your copy data on save parent and child projects, they can be the same project, right? You don't need to make it copy data from one project to another project. You can use this tool for some pretty neat tricks within the same project as well. And I just want to give an example, like I said, of the most common thing that we see people using this, having a screening project, which might have an open public survey URL. So you can do all the protections for avoiding bots on this specific screening instrument. And you can collect a lot of good data in there that you might not actually need in your study data. You just need for screening. Then taking those records that do pass the screening. So my recommendation is have a calculated field that determines eligibility and says, as long as that calculated field deems them eligible, copy their data and put it into the e-consent project. Same thing all over again, e-consent, right? If they have consented, pull data from that e-consent project and put it into the data collection project, which can then kick off your data collection for the purpose. And then for that data collection project, right, the only thing you have to care about is that it needs to collect the data for your research study. You don't have to care that it has to work for the screening. You don't have to care that it works for the e-consent. You can really craft each one of these projects to work and function as well as they possibly can without having to cross over those functionalities and get a Frankenstein of a monster of a project. Okay, so what are we doing on time? Okay, we got a minute. I just want to give a couple examples here. I'm only going to give one of these. Of course, it's great, but there are some creative uses for copy data on save that I love. One of them is having a multi-arm copy data on save randomization project where you can randomize somebody into a specific arm in a REDCap project based on a randomization value that's within the same project, most appropriately probably different projects. The one that we'll go into the example in just a second is the calculate radio dropdown fields. But the last one is one that has come up multiple times in the last couple of months, and I don't really know why it has. It's dyad studies. So these are examples of studies where you might have a parent and a child that need to collect the same data or collect similar data. You might have a project where it's partners. Either way, it gets difficult in REDCap to have a dyad study project within the same project, just the way that REDCap operates, right? You can only designate an email field across the entire project or on the instrument level. So if you had a dyad study and had two participants that had separate email addresses, you might need to have double the amount of instruments to collect the data. This will allow you to say, hey, each participant's a single record, and once they filled out their data, copy that data into the dyad project, where on one record you collect both team members or participant member studies. So you don't have to worry about making that project work for the dyads. You can just make a data collection project and then store the data in the dyad project. I know that gets a little nebulous, but that has been one of the most fantastic uses I've seen of this in the last couple months. All right, so just to close out, I wanted to give an example. This is using copy data on save not for its intended purpose. This is definitely an off-label use of copy data on save. one of the challenges when using the aggregate metric figures in REDCap, and if you used them before, is they're very limited, right? They don't have a lot of functionality that you might have in another analytical software like Excel. So one of the things that you can use copy data on save to do is to kind of fake a pivot table. What you can do is this example, you can see this is plotting, number of surveys on a time scale, and it looks awful. But you can use copy data on save to say, hey, this date value, I want you to take the month from that date field and make it a categorical response option. So you would have a categorical response for month. And then you could also have one for year for parsing that out into a calculated field, and then using copy data on save to take the data from the calculated field and apply it to that radio or drop down field to then get these nice little buckets for months instead of having a date field that just goes all over the place. And as an example of how this works, right? Like I said, you have your date field, you have two calculated fields that are just generating month and year from the date field. And then you have those radio fields underneath there where it's saying copy data on save, take the value from this calculated field. When I save it, apply it to that radio field underneath it. So you get a nice kind of way to bucket or do a pivot table on date data for transfiguring the data into a nice figure. All right.
That was
Thank you
pretty
guys very
cool.
much.